So now crizotinib as an FDA-approved agent is viewed as a standard therapy for ALK-positive lung cancer. The data for approval actually came just from single-arm studies, but now we also have data from the randomized phase 3 study of crizotinib, which was compared head-to-head with standard single-agent chemotherapy, pemetrexed or docetaxel. And in patients with ALK-positive lung cancer in the second-line setting, crizotinib was shown to be superior to chemotherapy in terms of longer PFS, improved response rates, improved quality of life and symptoms. So certainly there's really good data supporting the use of crizotinib. NCCN recommends testing of all patients with advanced non-squamous lung cancer for EGFR as well as ALK, and they do actually recommend frontline treatment of patients if they're ALK positive with crizotinib. And I should note that that data really is, that recommendation is really not based on a lot of data for crizotinib in the first-line setting. A trial recently has completed accrual of crizotinib, first-line crizotinib versus platinum pemetrexed as the chemotherapy comparator, and we may have results sometime middle of next year to show whether or not, or determine whether or not crizotinib really is superior to frontline chemo. So those results are, I think, anxiously awaited. But for the time being, based on the data so far that has come from the phase 1 and 2 studies, as well as from the randomized phase 3 study in the second-line setting, the recommendation is to use crizotinib as a standard agent, even as a first-line agent in ALK-positive patients.